नमस्ते बेटियों, सदा खुश रहो बेटियों. I, Dr. Shilpi Parnami, Associate Professor, Department of Community Medicine, FHS. In the previous session, we were talking about typhoid. Now we'll continue typhoid with the next thing, that is diagnosis. We have completed till complication. Now we will move on towards diagnosis of the typhoid fever. As I've already told you that typhoid is an acute infectious disease of the small intestine which spreads through fecal-oral route. For the diagnosis of typhoid, we will consider first of all the blood culture. Blood culture is basically it comes positive and during first week only. If will gradually the positivity, that means the sensitivity decreases, but if you take it during the first week, it will be 90% of the cases can be detected through blood culture. Coming on to the second diagnosis, which is urine and stool culture. Urine and stool culture basically they are positive during the third week onwards, and there is another test, the bone marrow culture, which is sensitive throughout the process. If you have taken antibiotics for say 4 to 5 days, then also this test comes positive. Now last but not the least, when you talk about typhoid, the test which comes in the mind is Vidal test. But this Vidal test comes positive during the second week, because this is a serological test. It detects the antibodies to OH antigen, and this antibodies develop during the second week. So like all other serological tests, if you want to do Vidal test, then you will be preferably doing during the second week. Vidal test, I like to discuss more in detail about the Vidal test. Vidal test is of two types basically. It is qualitative and quantitative. First we will talk about the qualitative test. In a qualitative test, it not only detects the antibodies to typhoid fever, but also it detects the antibodies to paratyphoid fever. So both of them can be detected through the Vidal test. So these typhoid and paratyphoid are commonly, like together they are called as enteric fever. If you will use the word enteric fever, then it will include both typhoid and paratyphoid fever. So Vidal test is basically aimed at typhoid and paratyphoid fever, both of the fevers. So in qualitative analysis, we take a slide and we make 6 circles on it. We take a slide and we mark 6 circles, 1, 2, 3, 4, 5, 6 reaction circles in it. In all these, we will do the marking O, H, AH, BH, positive control and negative control. So we will mark them like that, and then we will take patient serum. We will put 1 drop in O, 1 drop in H, in AH and BH. In positive control, we will mix all the antibodies and we will make a reagent and we will put in positive control. In negative control, there won't be any antibodies. So now the next step is putting the antigens. We will take O antigens and put it in the number 1, that is O circle, H antigen in H, AH antigen in AH, BH antigen in BH, none of the antigens in negative control, and any O or H antigen in positive control. Now we will mix these, we will rotate the slide gradually so that the reagents mix properly, and we will just wait and see for any agglutination. If we will say any agglutination, we will see the agglutination in positive control also. Suppose if we will see agglutination is O, there will be also agglutination in positive control. If we see in H, there will also be an agglutination in positive control. And if there is no agglutination, so there will be no positive control. Means agglutination, if there will be any agglutination is O, H, AH or BH, we will see the agglutination in positive control also. So like this we can find out whether the test is positive or not. This is just a qualitative test. There is another the quantitative test. In this we find out the titer. So in this we will take 8 circles, 1, 2, 3, 4, 5, 6, 7, 8. 4 for O and 4 for H. In this, in the first circle, we will put 5 microliter of the serum, patient serum in first, 10 microliters in second, 20 in third and 40 in fourth. And then we will do the marking 1:320 in first, 1:1:60 in second, 1:80 in third and 1:40 in the last one. For O, the titer 1:100 or 1:100, more than 1:100 is positive for O and 1:200 is positive for H. So likewise we can do the Vidal test and we can find out the titer also. In diagnosis I told you, you can also do TLC, DLC, ESR, but this is a non-specific test. In typhoid there is leukopenia. Then we'll come to prevention and control part. In prevention and control parts, the topmost thing is elimination of the reservoir. Along with reservoir, I told you there are all the types of carriers in typhoid fever. So we have to treat them and make them non-infection. Second is breaking the channel of transmission. So this can be done through making sanitation barrier so that the organisms from feces do not enter the mouth. This can be done through sanitation barrier, and this can be done by making sanitary latrines. So this is very important that we do this. Second, last but not the least, is health promotion. Health promotion is through health education and making the people aware of the sanitary measures and cleanliness. And the most important thing here is vaccination. For typhoid, there are mainly 3 types of vaccine. First one is live attenuated vaccine. This vaccine comes in the form of capsule, which one has to swallow on alternate days, like on first day, third day and fifth day. The immunity will develop 15 days after you have taken the third dose, and it will last for about 3 years. After 3 years, again you have to take these 3 doses, and this vaccine is efficacious for about 60% of people. And as it is a capsule, it is not usable, it is not rather advisable for children below 2 years of age, because they will not be able to swallow it properly. Second type of vaccine is killed vaccine. Killed vaccine is nowadays not used, that is outdated. The third one is the typhoid conjugated vaccine, VI capsular polysaccharide vaccine. WHO has recently approved this vaccine to be used in endemic areas. The National Immunization Schedule of India does not have this vaccine included in it, but Indian Academy of Pediatrics say that typhoid conjugated vaccine should be given to children between 6 months to 9 months of age. So this vaccine is about 70% efficacious. That is, if people take it, 70% of the people will be saved from this. This is the dosage is 0.5 ml and it is given intramuscular and subcutaneous in a single shot. This also lasts for 3 years, and again you have to repeat the booster dose. So this disease, which is very killer disease, especially for children, this can be prevented through vaccination, and especially in countries like India. So this we should get it done. If you see any thing like if there is an epidemic, or then this vaccine should be used. This all for today. Thank you very much.